All right, so good morning and Happy New Year to everyone joining this webinar. We're happy to welcome you to the first Generali Philippines webinar for 2022. And I am Henry Peloton, a Business Relationship Manager of Generali Philippines, and I will be your host for today's webinar. Now, researchers from South Africa discovered a new COVID-19 variant as what we know now as Omicron. December 2021, two returning OFWs from Japan was the first identified Omicron case in the country. Holidays have passed and we are now being threatened by the rising COVID-19 cases. Families and friends close to us, and maybe it could be one of us, have been infected by COVID-19. What is unclear for most of us is how different is the Omicron variant from the past variants such as Delta. And can the COVID-19 vaccines help us in protecting ourselves against the severe effects of the Omicron variant? And if we have been infected, how can we better manage the symptoms and recover from it? Now, some reminders before we officially start our program. Everyone will be put on mute so that we can hear our speaker well during his talking sessions. And you may still engage with us. Just send a message through the chat box right below the screen. Now, feel free to write down your questions for our speaker. The Q&A box is open throughout the top, and you can type your questions there, and we will do our best to answer it during the Q&A segment. Now, let us now begin our program. We are very privileged to have with us again our speaker for today. He is a graduate of medicine and surgery from University of Santo Tomas and one of the top notchers in the medical board. He obtained his fellowship in cardiology in UP Philippine General Hospital. He is the former president of the Philippine College of Physicians and an independent director of Philippines Health Insurance Corporation. He also served time as the medical director for some multinational companies. He received numerous awards such as the Outstanding Filipino Physician in 2008, the Outstanding Filipino in Medicine in 2010, and the Outstanding Tomasian Awardee in Public Health in 2020. Most recently, he was assigned as a special advisor for the National Task Force Against COVID-19 of the Philippines. He is currently the chairman of the Kilusang Contra COVID or KIL-COVID. Let us welcome on screen Dr. Anthony Lechuan. Hi, Doc.
Hi. Thank you very much, Henneth, for the kind introduction. I'd like to welcome everyone and, of course, thank everyone also for attending this, I think, very important webinar. Today's discussion is actually hot as today's headlines, and I'd like to zero in on the topic on hand and basically zero in on the Omicron variant. So for today, I'd like to present the flow or the agenda for this morning. I'd like to give you a snapshot of the current situation, global and Philippine data. And then let's focus on the new variant, yung Omicron. What are the clinical manifestations of COVID and then the Delta versus the Omicron? And considering the volume of patients that we have right now, how would we manage patients at home and at work? And then perhaps refresh our understanding or knowledge on vaccine boosters and the herd immunity, and what would be our recommendations as well as the metric of success. So ako, I will be presenting as a physician. This one particular book by Jerome Groopman emphasized that the thinking process without any political or business interest is how address this. So I'm wearing right now a doctor's hat so that we will not be affected by, let's say, shortage of, let's say, test kits or shortage of funds. So what's the ideal given that we have right now an ongoing search? Ang ibig ko pong sabihin, ano ba talaga ang tama textbook? Kunyari, wala tayong kakulangan in terms of the funds. Let's say we're living, let's say, in Singapore, or we're living, let's say, in areas na ang funds are available. Anong ba yung ideal before we actually adjust to the present situation? So globally, COVID-19 is continuing to spread around the world with nearly 300 confirmed cases and 5 billion deaths. And the countries right now suffering in the top list would be US, India, Brazil. and then UK and France. And very few places have been left untouched by this particular virus. Now, affected, as you can see, also based on the Johns Hopkins University, you can see almost every continent meron siya, no? And also on the severity of the case based on the Johns Hopkins University data, you can see yung severity from the time ng January 2020 up to January, andyan pa rin siya. Those countries na we thought na would be okay are also suffering, no, because of the travel borders. Let's say here you have Australia, then dito ang Philippines. Right now, yesterday, we jumped into the #1 place as a SEA sa Southeast Asia. So because this is a highly transmissible virus, we can see that it has actually affected the rest of the world. And of course, the bigger countries affected would be the US, United Kingdom, Italy. So they're just reeling from the surge of the winter, and then suddenly nagkaroon ka naman ng Omicron sa South Africa. So it was first reported November 24, and then November 26 it was announced by the World Health Organization as a variant of concern. Now, if you mean a variant of concern, what would be the characteristics? Ito ba highly transmissible? Is it severe? Would it render the vaccines ineffective? And when you had, let's say, COVID infection, are you prone to develop another infection, or what we call reinfection? Ang good side naman, though there are many cases, but the use for ventilators hindi ganun kagrabe compared with the Delta variant. So as you can see, kita niyo yung cases almost vertical yung kanyang line. Pero the need for ventilators, not as much as compared with the Delta variant. And tracking also, medyo gumaganda na ang cases in some parts of the world. Today, I saw in Twitter that the hospitalizations in the US, medyo bumababa na, and also in Europe. So that's good, but in our healthcare system, considering pumasok lang siya sa atin first week December, as mentioned by Hennet, and then nagkaroon tayo ng 5 cases, and then there's one super spreader event, I think the Poblacion Lady, and the rest is of course history na sabi natin. And we're barely 2 months after its discovery in South Africa. Wala pa tayong 2 months. January 26 will be the date after the World Health Organization declared this as a variant of concern. So we must not actually be complacent about this. Now, as you can see here in the chart, afflicted mainly are young age group kasi sila lumalabas, but the more vulnerable, rising din siya sa elderly. And this is our main problem. Though it is a mild condition, it may actually create more problems if the mild cases will reach the unvaccinated as well as the elderly. So it's common, of course, to those people who are actually moving around. In the Philippines, ang age bracket is 20 to 40 because of the mobility. But with this particular variant, I have seen cases for the last 2 weeks, cases involving elderly, particularly at home, mga resident homes, because of the contracting this from perhaps those people who are actually working, as well as from the pediatric age group. Now, as you can see also, atypical yung kanyang curve. The usual curve is parang Mayon volcano, but this one is quite vertical, no, in terms of its ascent. So medyo nasa acceleration phase pa siya. So this one is the DOH bulletin yesterday. And yesterday we registered 37,154, the highest natin, 39,000. So we have around 3.2 million cases since the time of its entry to the country, March 2020. This may be underreported, yung deaths natin, and the positivity rate is actually high at 47.4%. This is actually high. Ibig sabihin ito, almost 50%, 1 in every 2 will be affected. And the test natin should be higher, mga 100,000. But during the early part of the December, napansin natin at that time, nasa 20% na lang yung national natin. And the national capital region, ganun din. But right now, we're registering 49% at the national capital region, 57% for the national capital region, and for the entire Philippines, 49% in terms of ICU bed. Pag sinabi natin critical, it's actually 70%. So we're 13% na lang. Then we will say na critical na. But ang problema natin, before the ICU beds will be filled up, nakakasakit na rin ang healthcare workers natin. So even if you have enough beds, but you don't have enough health human resource, that will be a problem also for the country. And itong cases natin may be underreported because this is actually based or anchored on RT-PCR testing. Wala pa dyan yung rapid antigen test natin. So ang projection dyan ni Professor Guido David and Professor Jomar Rabahante, maybe mga 6 to 15 times pa siya because hindi pa natin nakasama yung rapid antigen test. And those people who are not being tested and symptom-based ka lang. So imaginein mo, it may be in the vicinity of 200 hanggang 400,000 yung cases natin ngayon. Considering parang every household meron. And with this high positivity rate, it's really dangerous kasi kunyari, lalabas ka 1 in every 2 ang magkakaroon. So the right approach is actually to stay home. Now, this is from Edson Guido, the head of the ABS-CBN and Data Analytics Group. So the 37,154 is a third highest single daily tally. And yung active cases natin hit a record 287,000 yesterday. If I'm not mistaken, 287,000 cases yesterday. That is a Philippine record. And the 47.4% positivity rate is the highest since that data became available. And yesterday was Sunday, 12 laboratories did not submit the data. So you can imagine the DOH data siguro nasa 50,000 to. And then again, the other tests, hindi pa natin nakakount dito. So we might actually be dealing with a higher number of cases pa rin. Now again, we had 3 surges, and this one is quite atypical because of the parang rocket ang pagtaas niya. So the typical is you have an acceleration, usually ganito. This one is, we had 3 surges, one in August of 2020. This was the time when the medical group called for a medical timeout. And then we had in Christmas of 2020, around 2,000 cases. And then this particular surge was triggered 15,000 at its peak by the UK variant and then the Brazil and the South African. And then may downward trajectory, but we opened the economy quite early. Dapat medyo mababa siya ng konti. Then dito nagkaroon tayo ng Delta. And the highest, the Delta was 26,000. And then with the vaccines coming in, and of course the bubbles, naayos natin, ang lowest natin, nag-318 pa rin tayo, December 27. And then the arrival of the Omicron from returning Filipinos and some nationals. And then right now, we're at 37,000. Now, we breached the 3.2 million cases and 50 deaths. This is actually underreported, but I welcome this kasi lower than the Delta. Dati nagti-300 deaths tayo. I'm just afraid that it might actually increase if we will not be able to vaccinate and we will not be able to control kasi it might reach the unvaccinated and the elderly population. So this is, to me, at this point in time, with increased number of patients, but we should be worried just in case it will actually escalate to involve the other vulnerable segments of the society. This one is from Dr. Benji Ko, and this was yesterday's editorial niya. Just like to emphasize that yesterday, sinasabi lang niya, maybe hindi tayo prepared. No? Most likely kasi hindi naman natin ina-expect na magkaroon ng Omicron. And we were okay. If you remember, we were at the cellar sa Bloomberg Resilience Ranking, September, October, November. And then we jumped 4 spots higher from 53 to 50 sa December. So we're okay. And then we were doing the vaccination. And then pumasok kasi siya, itong Omicron. At that time na hindi tayo prepared because holiday rush siya, and we were surprised on the rapid transmission as well as the magnitude of the increase right away. So yesterday, the Philippines landed number 13 among the nations in the world. And the Philippines got the first spot again after controlling this for several months. No? So medyo nasad tayo ng konti kasi eto na naman tayo yung problema. Parang hindi natatapos. No? But knowing what we know right now, we can do some things in order to help the country. Now, ang importante sa lahat right now, since it's like spreading like a wildfire right now, the best is to stay home muna and try to be educated. But at the end of the day, what will really help us is actually vaccination. Ang challenge lang is that the cases para siyang chicken pox na ang attack would be at the center, and then slowly that will actually escalate ngayon sa Luzon area and then besides Mindanao. And the challenge natin will be vaccinating yung Visayas and Mindanao, considering ang vaccination rate of the Visayas Mindanao nasa 30%, as opposed to the National Capital Region na maybe 90% and Calabarzon and Central Luzon 50%. But as you actually go peripheral, ibig sabihin kung mas malayo ka sa NCR, ang healthcare system mo may not be as stable than the NCR. So that may be a problem sa atin. And we will be at different stages of the disease. Ang iba nagre-recover, ang hindi. And that is the problem with an archipelago setup. Now, so basically the same figures din na pinakita, that's more updated. January 14. Again, hindi pa tayo bumababa. Wala pa tayong downward trajectory. So we have not reached the peak. I'm showing this slide to tell you na we're not yet out of danger. And the time to relax is not now. Kailangan natin pa ng vigilance. Now, also the report ng deaths natin may be underreported because at saka yung cases natin because of the lack of testing kits also. And as you can see, ito yung summary of the new cases. Okay, you can see here the positive test rate natin mataas. Sa Bloomberg kasi they use this para the parameter, the positivity rate. That's why we are at the bottom because yung positivity rate natin mababa, mataas, dapat less than 5%. Ang vaccination rate natin mababa rin during that time, nasa 26%, so it was recorded. So I'm sure this January, tataas na naman tayo sa Bloomberg because the two parameters, yung positivity rate and vaccination rate. So the reproduction number is still high. It's around, ang average natin nasa 2 or 3, but actually it's 4. So all the parameters in terms of the transmission ay increase. Now, this one is would show us na Philippines is at right now at the top at 31,000 yung average natin, overtaking Vietnam at 18,000, Japan 11,000, Thailand, and then you have South Korea. What is just important here is the success of Indonesia to flatten the curve. If you remember in Delta, Indonesia was number 1. And then you have Malaysia, and then you have Thailand. And then we imposed travel bans against these countries. Pero nakita mo ang Indonesia, despite number 1, bigger population, na control nila. So it's actually the strategy that we need to emphasize here, and dapat relentless pa rin ang consistency natin in trying to address the situation. Now, NCR cases may actually be underreported, as you can see here, kasi hindi pa nagagawa natin yung rapid antigen. This is based on Professor Guido's report and Joe Marabahante of the UP pandemic response. As you can see here, nag-testing ang Department of Transportation at nakita nila using the rapid testing. And it might actually be 6 to 5 times higher than the official numbers that we have. So if we have, let's say, 37,000, so we might actually be in the vicinity of 200 to 400,000. This is just to emphasize na the cases reported by the Department of Health may not be the reflective of the whole picture. So, okay. So the Philippines now has the highest number of 287,856. Ang ibig sabihin ito yung pwedeng manghawa. This is 4 times more transmissible than the Delta. So imagine if you have 287,000 people that may actually be active. So ganun siya kalaki ang impact sa atin. So again, I'd like to emphasize right now, hopefully we will be more careful, particularly at this point in time. Now, also, since slowly nagkakaroon tayo ng escalation in the countryside, particularly sa Visayas, Mindanao, magkakaroon yan, and this is the Typhoon Odette affected area, merong guideline or directive that air passengers traveling to and from Manila must be fully vaccinated according to the CAAP. And this is part of the Department of Transportation or the restricting the mobility of the unvaccinated due to the surge of cases. And the passengers must present their vaccination card and must have completed their primary dose series at least 2 weeks before. And this is basically to prevent the spread into the countryside, which ang problema natin, lower ang vaccination rate and the healthcare system may be weaker than the National Capital Region. Now, let's go to the clinical manifestations kasi alam mo malaking bagay if we know how to recognize, let's say, an Omicron versus a Delta variant. Initial studies coming from Japan and America, ang lumalabas, the Omicron would spare the lungs. And this would be explained in the next few slides. Ang original Wuhan strain natin, you have assorted symptoms or a variety of symptoms. Meron kang fever, meron kang chills, may cough ka, may shortness of breath ka, may fatigue, may muscle or body ache, may headache, prominent loss of taste or smell, sore throat, congestion. So during the Wuhan strain, all of these meron ka. But based on the report that we have, based on the report sa South Africa, sa US, and then UK, ito yung summary of their presentation. The Delta variant, which was the dominant variant all over the world, in the States is 90% na, in UK ganun din, would present with flu-like manifestations, fever, pero ang predominant nila, loss of sense of smell and taste, may runny nose, pero they usually would present with shortness of breath and usually within the next 5 to 7 days. And therefore, these are the patients who are prone to intubation and would be hooked to a ventilator. And 85% of patients would die pagka naka-ventilator ka. So, iba ang setup during the time nung August, September, when we had cases. Ang presentation mo during telemedicine, nahihirapan huminga, mabilis ang respiratory rate, and then lagi sila naka-hook, let's say, to an oxygen machine. All right. And difficulty at that time was finding a space or a room for patients in sa hospital. Ngayon, iba ang presentation ito. Ang Omicron would present same pa rin with headache, fever, and then a raspy sore throat, 2 days upon contact, and then infectious in the next 3-5 days. But ang predilection niya is not actually the lungs, or propensity to attack is not the lungs, but the upper respiratory tract. So ito yung sinasabi natin flu-like manifestation kasi wala siyang involvement masyado ng lungs. But very prominent as well is the general body pains and the fatigue, and that is the usual presentation. So this would actually be in the next 5 days. Ito naman during the 5-7 days. So they have different presentation. So it may be milder, but since it's more transmissible, it will affect a lot of the household members. So this is the focus ngayon. So just to summarize lang, you have a patient will present with flu-like manifestations. You have headache, fever, cough, and sore throat, and body pains and fatigue without much shortness of breath. So ito yung difference ng Omicron and Delta. And then you should also be careful because hindi pa naman completely eradicated ang Delta. I've seen a few cases of Delta pa rin because of their presentation needing hospitalization. Now, ang isa din dapat natin maintindihan, ang cases ng Omicron mild, 90% of cases. Bihira ang mga pasyente ma-admit unless otherwise late ang presentation and they will present with pneumonia na. Now, this one is a study from UK, just to differentiate, no? Very nice study telling us that the predominant symptom of Omicron would be a sore throat in more cases. At nakita ko yan in many patients the last 2 weeks, and then with fever and cough. In contrast with the Delta, they would present with loss of sense of smell or taste, and then you have red or irritated eyes, sneezing, and then shortness of breath. And makikita natin dito, ito yung symptoms. But what was prominent in the Delta was loss of sense of smell and taste, and of course the shortness of breath. Here you have sore throat, and then you have fever and cough. So when you have this triad of sore throat, fever, and cough presenting in the next, for example, in the next 2 days after contact, then you will have you have to suspect na may Omicron yung cases natin. Now, kahit siyang mild, hindi dapat natin siya i-treat na mild siya because maaring this is a Trojan horse. Kasi usually, kahit mild siya, it can bring about long COVID or the long haul syndrome. And according to Dr. Anthony Fauci, there's no evidence. Dr. Anthony Fauci is the #1 infectious disease in America. There's no evidence that there's any difference between a Delta, Beta, or now Omicron. We should always be aware that when people get symptomatic infection, anywhere from 10 up to 30% of cases will go to have persistence of symptoms. And even mild cases are included. Kaya I usually treat the patients kaagad symptomatically, parang walang residual. Kasi once na hindi mo na-correct, patients for months magkakaroon ng shortness of breath, fatigue, difficulty concentrating, insomnia, and brain fog. And that's why after recovery, you encourage the people to resume their usual activity, particularly exercising. Kasi ang nangyayari kasi, pag may involvement kasi ng respiratory tract, hindi natin nakakapag-exercise. May hinga lagi ang mga pasyente. And I think this is an important thing. So kahit mild siya, it can cause prolonged symptoms pa rin of the COVID after its recovery. Now, just to tell you kung ano ang difference ng mild, moderate, and severe, because this is important, lagi natin ano ba yung sinasabi natin mild? So this is based on the guidelines ng PISMID na ginagamit ng Department of Health. When we mean mild disease, ito yung symptoms na binanggit natin, fever, cough, fatigue, and then you have loss of appetite and muscle pain. Pero and then you have the loss of sense of smell and taste and all. Now, pero walang signs of pneumonia or hypoxia. Now, this is the presentation usually of an Omicron. But a moderate will be magkakaroon ka ng hingal based on the vital signs and respiratory rate at saka sa oxygen saturation. And then ang severe na disease naman would actually be necessitating hospitalization. And of course, the critical will be in a shocky situation. Meron ka ng acute respiratory distress syndrome, naho ka sa ventilator. So as differentiated from the Delta, ang Omicron would present with mild disease, and ang Delta would present with usually moderate hanggang critical stage. Napaka-importante. But we should not discount that mild disease can actually be progressing to moderate and severe depending on the vulnerable patients. No? Now, and according to Dr. Tedros ng WHO, we should not label yung mild kasi yung sheer volume of patients will actually affect yung hospitalization. Ma-overwhelm yung emergency room. And then pati ang healthcare workers magkakasakit even before mapuno yung hospital. And siguro yung messaging natin mild and a blessing, dapat hindi natin siya i-consider kasi the right approach pa rin is not to develop natural immunity at this point in time. The best pa rin is to have your immunity through vaccination and then strengthened by the boosters. Several countries dati, like Sweden before, during the initial stage of the Wuhan, tried doing the exposure to natural immunity and it resulted in deaths, particularly in a vulnerable segment. So even if it's mild, I don't think we have to expose ourselves. Okay. Now, ang other problem of Omicron, it invades the immunity better than the Delta because nagkakaroon siya ng mutations. And this is an important finding. No? Nagkakaroon siya ng mutations at the spike protein. This is the structure that would attach to the cell. And nakita nila, usually, nagkaroon sila ng mga 30 to 60 mutations. So the Omicron variant was 3 to 4 times more infectious than the Delta based on the study in Denmark. And 48% have been fully, 78% have been fully vaccinated, while nearly 48% have received a booster. So, in one report sa St. Luke's Hospital, in an interview, according to Dr. De La Peña, 40% admitted at the St. Luke's unvaccinated, 40% vaccinated, may 10% booster. Ang problema lang, according to him, dapat mag-aral tayo whether kung kailan nabakunahan yun. Kasi di ba the booster should be 6 months difference from the primary vaccine to the second to the boosters natin. Kaya it has been shortened to 3 months. So, nire-review upon admission when ka na huli nagpabakuna. So, we started the vaccination, if you remember, March 1. Kaya by this time, baka yung antibodies natin nag-wane. Kaya for those people na hindi pa nakapag-booster, I think we need to do the boosters right away. Now, just to summarize the report, globally, this is by Dr. Eric Topol, one of the 5 best researchers in America. Ang good news regarding Omicron, we know now how to reduce it by using face masks, especially medical grade, and then of course, distancing and ventilation. Ang problem lang, ang bilis yung mag-double. Usually in 2 days to 4 days, pwede ka mag-increase. Now, ang vaccine effectiveness, pagka nag-booster tayo, talagang it can actually increase. According to Professor Gloriani, ang first dose will give you 50% protection, second dose will give you 70%, and the third dose can give you 90% protection. Yun ang beauty nun. But ang problema naman, pag 2 doses lang, it can drop to 35%. Kaya kailangan natin ng booster. Ang severity, less hospitalization. Ang problema lang, more cases sa outpatient department. Yan ang contrast. Is it a good problem? No, it's not really good pa rin. Kasi considering yung household members, ang dami. Ma-overwhelm considering ang ratio ng doctor in the Philippines is 1 is 10,000. So this one is an upstream problem. Ang ibig sabihin ng upstream, ibig sabihin bago ma-hospital. This one is a downstream problem. And nakita natin sa Delta, the Delta yan. And then immunescape, you need a third shot, no? And it might actually be a fourth shot pa nga. Israel and Chile came up with a fourth shot already. And reinfection is possible. Now, so if you study the hammer and dance concept, ganito yung nangyari sa atin. Hindi pa tayo makagalaw ngayon because na-shock tayo with the hugeness of the problem. But we need to do some mitigation measures. Kaya ayaw naman ng government natin mag-lockdown during the time because of the economy. But ngayon, para nagkaroon ng forced lockdown, ayaw din lumabas sa mga tao. And then usually, kailangan tayong makontrol bago tayo magkaroon ng reopening of the economy. But we should actually maintain yung testing natin, contact tracing and all. So ngayon, nandito pa lang tayo. Wala pa tayong peak. Ito yung peak na sinasabi natin. And while actually on lockdown, we should be preparing ourselves by educating the people, improving the treatment, and then of course, yung testing and tracing natin nandun pa rin. And then once na nandun tayo sa quiescent period na naranasan natin during the time na November, December, alright, nagawa naman natin yun. Kaya lang nagkaroon tayo ng problema in terms of the Omicron. Tapos kulang tayo pa sa testings. Yan ang weakest link natin is sa testing. So ang problem natin for the longest time is that pag nagkaroon tayo ng surge, nagla-lockdown tayo. Ang dapat natin ginagawa, like other countries, ini-strengthen natin dapat yung testings natin. So the usual cycle is like this, no? We will impose a stricter lockdown, and then when there's a slight dip in the cases, we reopen the economy, and then magse-surge na naman tayo. The right approach is actually strengthen this part, yung testing and tracing and the public awareness campaign. And ever since, our weakness would be in the testing and the tracing. No, sayang, no? Sana nakapag-prepare tayo sa testings like other countries. And we should not rely always on the rapid, on the RT-PCR kasi it's quite expensive. And then ngayon, medyo matagal ang pagkuha. We should have been prepared with the self-administered kit or the DIY or the home kits na dapat ini-implement natin. So I'd like to emphasize that every Filipino citizen, every employee should be able to understand ano ang testing na ngayon. Kailangan marunong na tayo. Who is infected? Very important. And then pag na-testing positive, then matitrace mo siya. Who are those in contact with the infected? And then isolate. So once you identify the symptoms, isolate na. And then mag-testing na kagad. And then after that, magte-tracing na tayo. And then yung close contact i-quarantine. So every Filipino by this time should be able to identify the symptoms and then apply the 4 pillars to control the COVID-19. This is Dr. Michael Mina. I'd like to introduce to you kung pina-follow niyo sa Twitter. Siya ang primary advocate ng rapid antigen from Harvard Medical School, a prominent immunologist and infectious disease expert. Ang reminder lang, rapid antigen tests are not affected by your symptoms. And rapid antigen tests do not care about symptoms. They do not detect symptoms. Ang importanteng question, am I infectious? Kunyari, may close contact, nagkaroon ng symptoms. Ang question mo pag nagkaubo ka, am I infectious? That's why ang sinasagot ng rapid antigen test yun. Ngayon, kunyari naman, you want to find out asymptomatic ka, am I infectious? Kasi there are patients, 40% of patients asymptomatic. So nagpapa-rapid antigen ka. Kung asymptomatic ka, asymptomatic at negative, wala lang, isolate ka lang and then vitamins ka lang. Pero once you are positive and you're with symptoms, mas lalo ka mag-isolate kasi you're capable of transmitting the disease more than the asymptomatic. And the rapid tests work identically well to detect the virus regardless of whether you're asymptomatic or symptomatic. All right. Okay. I hope that's clear. Perhaps we can dwell on that later on pa. Now, this one, ang sinasabi ko when I was interviewed by DCRH last week, ang mga hospital sa NCR, hindi na dapat hintay mapuno bago itaas ang alert level 4. Dapat yan ang opinion ko, hindi natin pinaabot ng almost 40,000. dapat nung mga 20,000 pala na nagdo-double, medyo hinigpitan na natin kaagad. We nip it in the bud right away so that hindi tayo nagkaroon ng rapid transmission. Ang nangyari kasi ngayon, masyado mataas ang base natin, 40,000, ang dami ng active cases natin. Kaya ngayon, ang alert level 3 natin, ang daming areas in Luzon, Visayas, and Mindanao. So dapat preemptive tayo. Nung nakikita natin nagdodoble from 318 December 27, tapos nagdo-double siya. Dapat nip it in the bud for 2 weeks based on the hammer and dance concept para hindi siya umabot ng mataas. Ngayon, it's very difficult to control considering rapidly transmissible and then ang taas ng base natin ngayon. Now, yun nga sinasabi natin, should we implement the same approach? Because according to Albert Einstein, doing the same thing over and over again and expecting a different results is insanity. Ang strategy ngayon, compared dun sa Delta, will be different. Ang strategy ngayon, to me, is basically to avoid hospitalization by actually identifying the symptoms and then rapid antigen rather than RT-PCR. And then, ngayon, empowerment na kasi masyadong marami ang volume ng patients for the doctors to engage the patients considering ang daming pwede mag-telemedicine and you don't want to go to the hospital. So, ang kailangan natin ng strategy ngayon is actually empowerment of the workplace at saka at the home base. Now, I'd like to review some of the new guidelines ng Department of Health. And last week nilabas yan. Now, this is the problem. Because of the reduction of the workforce, ang mga doktor, yung fully vaccinated, nabawasan yung kanilang pahinga. So the isolation, let's say the isolation, positive case, asymptomatic, mild, moderate, ang current 10 days, ngayon 5 days na lang. Kasi affected ang mga healthcare workers nahahawa sila At ang quarantine dati, ng close contact, 7 days, ngayon 0 days na lang. So that is a problem. Kaya in some hospitals, pagod na pagod yung mga doktor. So even hindi pa puno yung hospital, because of the lack of manpower, nagkakaproblema tayo. Now, again, for the general population, again, for positive, asymptomatic, mild, moderate, kayo po yun, fully vaccinated 10 days or at the advice of your doctor. Kung positive ka naman, with severe and critical days, mas matagal, 21 days. And then, ang quarantine for close contact, 7 days for the fully vaccinated. And for the incomplete, vaccinated or unvaccinated, 40 days. So, ganyan ang situation natin. Okay, so this is for the general population. Now, for the travel naman, I think you would be more interested in the yellow, considering ito yung mga galing, let's say, America. So, let's say you're coming from, let's say, the US, pre-departure, magte-testing ka, and then you stay in the facility with day 5, and then release after a negative test. And then continue your isolation at home, no? Kaya lang in other countries of the world, mas mahigpit sila because they don't want local transmission. Like for example, in Hong Kong, 21 days ang quarantine nila and then ban other countries. Now, perhaps the government should revisit our travel guidelines considering the number of cases na dumadating sa atin on a daily basis. Now, again, this is the infographic na ginawa ng Department of Health for the antigen kits and the self-administered. This is for healthcare workers and then for the home kits, no? And I think they're rushing right now on the test kits na i-regulate nila. But I think what's important right now, those are used sa Singapore and the US, like mga brands na ganon, I think pwede naman magamit. And I think the Department of Health should encourage the workplace na gumamit ng self-administered kits or home kits based on the best practices at i-register right away so that the people will be empowered to use the antigen, the rapid antigen test kit, though supplemented by a video so that the people will understand it. Now, ang kailangan na natin is to simplify Ang problema natin this is the late Colin Powell's telling that great leaders are almost great simplifiers. Ang kailangan natin is a quick algorithm in the company so that in the company or in the workplace or at home, kung paano. So, ang recommendation ko, napakasimple. So, identify mo muna and then isolate and then testing. And then, after that, pwedeng symptomatic relief ka para hindi ma-overwhelm yung patient. Kasi kung late ang presentation mo, then kaya nagkakaubusan ng mga medication ay hindi marunong mag-home care remedy sa mga pasyente natin. And then after na gumaling ang patient, they say after 7 days, and then the next thing to do is vaccination and boosters. Dapat ganun kaklaro eh. So I think kaya medyo complicated. Wala silang algorithm right now on how to do this. Now, ang differentiation din, of course, this is expensive na dapat babaan na natin ng cost. And then yung rapid antigen test we should be able to use that, no? Ang problem lang natin is the poor segment because the middle class and the upper class can actually do this. Ang problema natin is the 40% of the population natin below poverty line. And we can get the results right away in 15 minutes eh. Samantalang ngayon, ang hirap-hirap, no? Kaya I'm using the rapid antigen test sa mga pasyente ko. So, alam na natin ang pag-interpret, no? Makita natin, you have the control of the test, no? This is the positive, no? Pagka may faint ka, positive na lang, positive pa rin dyan. If you want to repeat it the next day, okay lang naman. No? But basically, if you have symptoms and you have faint results here, positive na rin yan. Now, kunyari, you are negative here, yung mga ganitong klase, no? I mean, we must improve Okay, just to guide you on the antigen test, okay, and then symptomatic, okay. So bear with me kasi very important to. Let's say you are symptomatic and the result is positive, all right? Highly likely positive, isolate immediately. Now, if you are symptomatic at negative yung test, isolate immediately and test with an RT-PCR, right? Yan ang recommendation nila. Exposed to COVID-19 positive but asymptomatic, but the test is actually positive, likely positive and isolate immediately. Exposed to COVID-19 but asymptomatic then negative, quarantine first and test with an RT-PCR on day 5 after the exposure. Not exposed, no symptoms, positive, isolate pa rin and consult your healthcare professional. Not exposed, not symptomatic, negative, follow the safety protocol pa rin. Simplify ko lang yan. If you have symptoms, whether positive or negative ka, i-assume mo na positive ka. Kasi it might be early on. Ang importante sa akin yung symptoms. Because the asymptomatic, clearly isolate mo yan at gagaling yan. Ibig sabihin, they have a better immune system. So to simplify this medyo complicated slide, I'm always for the symptoms. Kung positive, I treat right away. Kung negative, I would treat them. But of course, siyempre, mas ang case mo dito hindi grabe. But dapat may suspicion ka na pag may symptoms ng patient. Kasi they're in the same workplace, nasa same household din sila. No? And I think we need to understand yun. Now, 85% of severe COVID patients in the US are not vaccinated. But reports right now, nakikita natin, it may also be present in vaccinated individuals depending on the timing of your vaccination. In terms of the booster, we know for a fact that very important yung bakuna, and we cannot overemphasize our personal responsibilities. I think we have mastered this already. We have mastered all of these things. Now, we thought that after the vaccination and Delta variant, we were okay. But there are countries na lesser yung vaccination rate, and therefore prone to develop mutations like sa South Africa. South Africa, ang vaccination rate ay mababa, 25%. Nagkaroon tuloy ng opportunity, of course, na mag-mutate ang virus. So nagkaroon tayo ng Omicron. So ang problem natin in the Philippines, hindi lahat highly vaccinated area. So therefore, we must fast track yung vaccination in those areas, particularly in Visayas and Mindanao. If you remember, during the time ng September, na ang vaccination rate natin nasa 25%. So ganito ang herd immunity natin. Mababa pa lang. Our target should be 90%, no? I think we're right now 54% as reported by the Department of Health and the National Task Force. But if you have a variant na katulad ng Omicron, our percentage of vaccination should actually be increased to 90%. And herd immunity will prevent viral transmission. Medyo malayo-layo pa lang tayo. Now, this was Margaret Keenan and this is May Parsons after 1 year. So, ang ibig ko sabihin, na after 1 year, okay pa rin naman si Margaret Keenan. And then the best gift na pwede natin gawin is actually to have a booster shot ngayon kung hindi pa tayo nakakapag-booster. And we should do it as soon as possible because of the rapid transmission of Omicron. Now, kailan nagkaroon ng booster based on history? So after na mag-celebrate ang Israel, the first country to ditch the face mask, sometime in May and June. Now, nagkaroon ng Delta variant sa India, napansin nila na dumami din ng cases sa Israel. And what they noticed, those unvaccinated individuals, marami ang number of deaths. Ang daily death rate nila nag-increase. But what they noticed also, pagka 2 shots, bumababa yung death rate. At pagka 3 shots, look at the death rate, masyado siyang mababa. So this particular study by Israel triggered yung pagba-booster, and that led to the US FDA and the CDC to adopt the booster shots. And very important yan. And the rest of the world followed. No? In other countries, shorter. Like UK and Canada, tayo din 3 months. In the States, 5 months ang difference of the waiting time of the primary vaccines to the booster shot. And many countries ang nag-start na yan, but the trailblazer is actually Israel. So they started the booster shot July of 2021 using the Pfizer. And then the rest of the world followed with the other vaccines, but it started July. So, and then Israel came up with the 4th vaccine so that they can actually quell the transmission of the Omicron. So Israel and Chile right now, nagka-4th dose na sila. And my gauge is that on a yearly basis, magkakaroon tayo ng booster shots. Now, for Omicron, we need talaga 3 vaccine doses, and that is key for protection against the variant. That is very, very important. And sa Israel, ang strategy nila is to conduct approximately 100,000 PCR tests. And once you're positive, they have a more accurate Omicron-targeted PCR test. And after the second PCR test, all suspected Omicron tests are sent for genetic sequencing. In the US, they expanded the access to the booster shot and vaccination for kids. And then President Joe Biden released $2 billion for free rapid testing, and then extending the public transit mask requirements. No? And they have stringent testing also for international travelers. And I think we should also do that. No? Ang problem lang natin is the cost, considering ang budget constraints natin enormous because of the need right now for, of course, rehabilitation ng Typhoon Odette natin at the time na nagkaroon tayo ng Omicron. And eventually, we will have problems also with the manpower. And this has been happening in other parts of the world na nagkakaroon tayo ng shortage talaga ng ating healthcare workers. And ang problema natin eventually is the unvaccinated, then mataas pa rin yung mga unvaccinated individuals natin. And we should do massive information campaign. I know it's discriminatory to some, but this is for the sake na we protect the majority of the population natin. Ang target pa rin of the government is to 90%. And hopefully, in the next 3 months, we'll be able to achieve that, considering we have the vaccines na lang. And challenge lang is that in Visayas, Mindanao, we have power and communications lines right now down, and we need to deploy the vaccines as well as the medical supplies, particularly in the typhoid afflicted areas. Ang challenge din is also the kids because they will be vaccinated. Of course, na-approve na yung 5 to 11. Ang problema lang, isa lang vaccine ang pwede mong gamitin, and I think that's Pfizer. And then we have to consider the supply. Kaya may academic break sila ngayon because of the rapid transmission of the Omicron. But I think it's an opportunity to educate the kids. And then the government should ramp up, of course, the procurement for mRNA vaccines. Now, if you are right now on the primary vaccines pa rin, just to refresh your memory, Sinovac, you can use your, ang third dose mo can be Sinovac pa rin. Alright? This has been shortened to 3 months, no? And then heterologous mo, either Astra, Pfizer, Moderna. Okay, and then if you're Astra, Astra ko, primary dose ko. Ang aking booster shot ay Pfizer that was given to us at Manila Doctors Hospital. So, and then yung iba naman Pfizer, then you can have homologous Pfizer, same brand, and then Astra or Pfizer. Then Moderna, and then Astra or Pfizer. You have Sputnik, and then Astra, Pfizer, Moderna. If you have Janssen, at least 2 months in the Philippines, not 3 months. And then Astra, Pfizer, Moderna. So this is the choices na meron tayo. Sa Sinopharm, I think the President considered or inoculated himself with a Sinopharm as a third dose. Though ang baba lang ng Philippines in terms of our dosing schedule for the booster shot, I think wala pa tayong 1 million. And Chile is on top of this. Kaya ang Chile right now is the #1 in the Bloomberg Resilience Ranking. And this is about preparedness and agility. Now, ang question, this is from the CDC. Do you need to wait for the booster shot if you had COVID? Ano ang guidelines dyan? According to the CDC, you should wait 10 days after your positive test before getting your booster shot. Ang reason for that, kunyari nagkaroon ka ng COVID, ang recovery mo mga 7 days hanggang 10 days. But mga 5 to 7 days. So, prepare ka na niyan. So, pag tinanong ako, kailan ho niyo, Doctor, pinapa-booster shot ang mga pasyente? Usually 10 days hanggang 14 days. But usually 14 days. Kasi, siyempre, you have the symptoms from the COVID. You want the patient to recover because alam mo naman, after a booster shot, you can develop, you can have muscle pain, you can have fever. You don't want to aggravate the situation. All right? So, ang time na binibigay na CDC ay 10 days hanggang 14 days. But what is more important ngayon is ang paggamit ng N95. I think it is mandated. If you're going to use this particular mask, yung surgical mask natin, be sure that it's snugly would fit, no? And ako nagdo-double mask ako pagka itong ginagamit ko. If you're using a cloth mask on top of a, if you have your surgical mask, then magpapatong ka nito. These are the guidelines, no? But to simplify things, if you can order a high grade or a medical grade mask, that would be better in a highly transmissible variant, no? And very, very important to protect ourselves. Now, it is said that ang persons infected and persons not infected, as you can see, pag N95 ang ginamit mo, the protection is 25 hours. And if they're using sealed N95, where only 1% of the particles can enter the face piece, they will have 2,500 hours protection. Ang problema natin is the limitation. But ang investment natin should be actually be on a high-grade facial mask. So for example, here, makikita natin kung surgical mask ka versus nothing, person infected, ganito siya. But we can see right now the wisdom behind protecting ourselves with high-grade or medical-grade face mask. All right. Now, ang other good news is that we have molnupiravir. No? Based on the study by Merck, it can decrease the hospitalization and death by 50% and used in the first 5 days. No? So, meron yan sa City of Manila, some hospitals. And once na may symptoms, nag-positive ka, you can use these 200 milligrams, 4 tablets for 5 days, no? So that you reduce hospitalization and death. And according to Dr. Eric Topol, we will have the available tools natin. May vaccine tayo, may mask tayo, may molnupiravir tayo, may Paxlovid pa, that's the Pfizer antiviral drug na 90% effective in terms of reducing hospitalization and death. And then hopefully we'll have a rapid test na rather than RT-PCR ang gagamitin natin. This is the checklist na soon dapat meron ng mga Pilipino. But according to Congressman Stella Kimbo, was also been down with COVID, no? Ang dapat tayo meron tayong home care guidelines and kits. So just to quote her, nais natin hindi mapuno ang ospital, magagawa ito kung meron tayong epektibong home care guidelines para sa taong mild to moderate ang symptoms. At ang Department of Health should be the one taking the lead in making sure that the Philippines are equipped with this essential information. Kaya lang ang problema, overwhelm ang Department of Health. Kaya dapat mag-empower tayong lahat. Effective home care practices are essential in mitigating the risk to our healthcare system. Now, yung economy natin will never recover as long as the virus is not controlled. And if we don't understand this, then we're part of the problem. Laging yan ang concern natin. Dapat hindi tayo nagmamadali. Kasi kahit mild to, it can really create problems for the economy. And eventually, yan, nagiging problema natin. Nagkakaroon na ng sakit din ng ating healthcare workers. And this can lead to burnout syndrome, demotivation, and of course, quitting, and then brain drain tayo. And we should address that. And I think just like to echo what the director ng World Health Organization, I think ang target natin should be to vaccinate 70% of people as soon as possible, to strengthen the health security by actually sa atin, no? We have to strengthen yung health insurance natin. And of course, our primary care, kailangan okay, universal healthcare maayos natin. Kung wala, then we have to invest on insurance so that kung magkasakit tayo, we're okay. But what is important is to vaccinate the population. So these are the metrics na ginagamit ko always pagka ako nag-interview, nagle-lecture. Kailan tayo talaga nagbababa ng restriction? Is the viral transmission controlled? I don't think so. Our healthcare system are hindi pa in place ang testing and tracing natin. We should have a nice algorithm here. Alam mo sa workplace, okay naman But ngayon, even the hospitals are actually affected. Ang travel restrictions natin, hindi masyadong namamanage. Nagkaroon nga tayo ng problema dito. May mga loopholes, may mga leaks pa rin tayo. And then, all the more that ngayon, ang community should be educated, engaged, and empowered. Ito yung kailangan natin. And after 2 years, we need to do a lot of things pa rin, no? And hopefully, ang future natin ay ma-improve natin ang ventilation natin, libre pa rin ang testing for essential workers, magkaroon tayo ng magandang contact tracing, create a network of health facilities and barangay to tertiary hospitals. Kailangan magandang telemedicine mo. We need to compensate our healthcare workers. ang case data management natin, ayusin natin. Mass transportation, very important. And we need to vaccinate as soon as possible ang population, particularly the vulnerable segment and also the children. And then provide funding for health. More funding for health. No? Number 5 sa budget, but perhaps later on, dapat nasa top 1 ang health natin, considering galing tayo sa crisis. Now, again, we can make the choice to live a socially responsible citizen. I think I admired a company na laging they want to empower their employees. No, we can make a choice to break the rule or to follow them. Nangyari doon sa Poblacion Lady, no? Yun ang sad thing about it. No? Hanggang ngayon, hindi natin natututunan yun. And ang problema, even we have the ability, sometimes we have the talent, we have everything, educated tayo. Our choices are usually wrong. And yan ang nakikita ko. And sayang yung gains natin for the last 2 years only to be lost by not following the rules. So very, very important. And that's one reason kung bakit tayo in a crisis ulit after a long while. No? And every day, lagi ko sinasabi on how we can contribute to society. I'll always think that we should think about the metric by which our life will be judged. And if we can contribute to society in a little way, gawin natin yun. Because it can actually cause ripple effect and make a resolution to live every day so that in the end, when we face God, we will consider our life a success. And I always think of my family, particularly, ito nung nandun kami sa Baguio and nung nasa Baguio kami, tuwan-tuwa kami, 318 lang ang cases. Yun mo, nakapag-Baguio kami December 26 hanggang 30. And then pag uwi namin, nagka-surge na. We always work for our children and our children's children. Importante yun . And once we protect the family, we protect the workplace, we protect the country. So this is my last slide. Please stay strong even when things begin to fall apart. Stay strong. And yesterday was the Feast of Santo Niño. We need to pray hard for this country. So maraming salamat po and I'm willing to answer some of your questions. And thank you very much po for your kind attention.
All right, thank you very much, Dr. Leachon. And I do agree with you po, talagang na caught off guard siguro ang Philippines and knowing yung pinakita niyo pong trend na nag-shoot up talaga siya from December to the current day, na mas alarming po talaga lalo ngayon. And yung active cases natin is hindi pa nga po talaga conclusive kasi hindi pa totally reported yung active cases. So now we are activating the live Q&A box to accommodate your questions for our guests. And please write down your questions in the Q&A box found in the bottom of your screen. So let us start. Meron na ditong mga nag-send na ng question. So, hi Doc, may I ask if COVID immunity for a certain period like 3 months for those who have already contracted COVID? Meaning, hindi po ba nagkaka-COVID pag nagka-COVID na for a certain period of time?
Ang definition kasi ng breakthrough infection is 2 weeks after the vaccination. Yun ang ibig sabihin ng fully immunized. No? So, kunyari na booster ka, dati yun ang definition natin. Kailan nagka-Omicron, nag-third dose tayo. Hindi porke nagkaroon tayo ng booster, hindi na magkakaroon. But ang promise kasi niyan, mild yung symptoms at hindi ka ma-hospitalize or mamamatay. Yun ang promise doon. But even nakapag-booster ka, according sa St. Luke's nga, mayroong mga na-booster, nagkaroon pa rin ng COVID. Depende dun sa vulnerability ng pasyente. Pero ngayon nakikita natin na mas maraming mga pasyente unvaccinated kaya dapat magpabakuna tayo. So ang question, yung 3 months ba magkakaroon ka na ng immunity? Nobody can tell. According to the study ng Moderna, after the booster, it will protect you from 9 months to 12 months. So most likely, ganun na magiging trending. Kailan ka kagad sisipa yung immunity? After your injection ng 2 weeks, okay ka na, tataas na kagad yun yung sinasabi nung ni Dr. Topol. Tumataas kagad by 90%. Ang third dose, tandaan nyo, is 90%. Now, kung magkakaroon tayo ng booster shots later on, mas mag-i-increase pa yun.
Thank you very much, Doc. So we have another question. Hi, Dr. Lesion. Do all the symptoms have to be present to determine na it's COVID and need po ba to be tested?
You need a syndrome, at least kahit man lang tatlo. Ang yung triad, fever, cough, and sore throat, yun ang nakikita ko. But if you have a conglomeration ito, you have fever, cough, sore throat, headache. Hindi isa kasi sometimes may headache ka, hindi. Usually dalawa. But very important, kahit sa sore throat, pag nagka-sore throat ka at masakit, usually yun ang sign na nakikita ko. But 1 or 2 symptoms, pwede mo na sabihin na meron ka. Then kailangan mag-isolate at mag-testing ka. In the last 2 weeks ako nag-practice, I have seen 700 patients. Ang dami ang presentation talaga sore throat. Usually masakit na sore throat siya na nagigising pa sila sa gabi. And once na, ang dami nagko-complain na ganun. And I think si Dr. Willie Ong, no, sinabi rin niya sa kanyang Facebook na ganun ang naramdaman niya. So, hindi isa, no? Kasi we cannot make a diagnosis ng isa. It has to be a syndrome or a combination of 1 or 2. Pero pag isa, nakita natin sore throat based on the study sa UK, ang laking bagay na maaring Omicron siya. And then pag loss of sense of smell or taste na isa, maaring Delta variant yun. Yun lang ang sagot ko. Kasi mahirap sabihing fever lang ang kunin mo kasi pwedeng flu, minsan mainit lang pakiramdam mo, or cough, mahirap Pero what is significant here, yung sore throat. Pag nag-sore throat ka talaga ng masakit, may correlation na maaring meron ka kagad na Omicron.
I see. Doc, regarding ulit sa symptoms, if you had COVID and you had loss of smell or taste, does it mean na hindi po Omicron yung COVID variant ng patient?
Hindi pa rin kasi ang nilalagay lang dun kasi maaring present doon sa Delta variant, no? Pareho pa rin pwedeng, marami kasi pa rin variants sa atin di ba? And then they can present. What's important here, pagka nagkaroon ka ng loss of sense or smell or taste, baka siya Delta, makakakilos ka ng aggressive. Kasi kung Delta yan, alam mo na pwede ka magkaroon ng pneumonia or affliction of your lungs. And therefore, mas toxic yun. Dapat mas imo-monitor mo. Knowing na sa Omicron, bihira ang loss of sense of smell or taste, at least kampante ka na mild siya. Pero pagka nagka-loss of sense of smell, taste ka at alam mo prominent yun sa Delta variant, mag-iingat ka, magmamonitor ka ng oxygen saturation mo. So yun po ang gusto ko lang explain. And that's a good question na pag ba may loss of sense of smell ka, masasabi niyo bang hindi Omicron? Hindi pa rin, pero the presence of that particular symptom maaaring Delta yun. So kailangan mag-ingat ka kasi hindi pa rin completely eradicated po ang Delta.
How do we differentiate, Doc, yung rhinitis at saka yung Omicron?
Ang rhinitis, ibig sabihin may sipon ka. That's another symptom. Usually, ang Omicron kasi upper respiratory. Okay. And usually presentation niya runny nose, no? At may sneezing. Now, hindi mo madi-differentiate Ibig sabihin presenting symptoms siya na maaari may Omicron ka. So pagka nagkaroon ka ng rhinitis, then isang indication na dapat magpa-rapid antigen test ka kasi doon mo naman kukunin yung sample And once na may rhinitis ka, that is perhaps a time na mag-testing ka kagad ng rapid antigen kasi mataas yung viral load nun at doon mo makikita ang positive. Siguro ang kine-question lang niya kung may allergic rhinitis ka kasi rhinitis talaga parang sipon na.
Sipon, opo.
Oo, ang allergic rhinitis ay present everyday. Kung present everyday, mahirap i-distinguish. Madi-distinguish mo yan kung may lagnat ka at may develop ka ng ibang symptoms pa. Let's say, meron ka sore throat or cough. Kasi baka mention allergic rhinitis which is present in the morning na pagkagising mo usually may sneezing ka, pero pagka bandang tanghali na wala na. And this is caused by pollens tsaka sa early morning. Yun ang differentiation nun.
So another question, are we expecting another variant of concern in the near future, given that not all people are being vaccinated?
As long as hindi tayo vaccinated, we expect na baka magkaroon uli ng variant. And we don't know kung anong susunod, no? Kasi anong nangyari, di ba, if you remember, ang SARS, 20 years ago yan, tapos nagkaroon ng MERS-CoV, and then SARS-2, tapos nagkaroon ka ng COVID, and then ang COVID, nagkaroon ng 10 variants. Itong marami tayo, di ba, if you remember. So akala natin Delta will be the last one, and then suddenly nagkaroon ka ng Omicron. So we cannot predict. Depende yan sa immunization status at vaccination rate ng country. Pag ang country mo ay mababa ang vaccination rate, pwede ka pa rin magkaroon ng variant.
Opo. Doc, follow-up question lang regarding sa SARS na na-mention nga po kanina. Bakit po kaya sobrang bilis mag-mutate into other variants si COVID kumpara kay na SARS pati ka na MERS-CoV?
Ito. Because ang problema kasi dito, yung ating spike proteins afflicted niya, doon nagkakaroon ng mutation. And during that time ng SARS at saka MERS-CoV, suddenly nawala kasi siya kasi hindi pa siya ganun ka-virulent. Nung nagkaroon tayo ng COVID noong May 2020, hindi pinansin yan ng China, hindi pa siya nire-report sa WHO. So nangyari, dumami ang cases hanggang naging uncontrollable. If you remember those times, no? And then kumalat all over the world. Pero yun, kung right away in-identify ng China yun, hindi pinaglihim sa World Health Organization, natapos kaagad yun kasi i-cordon off mo lang ang China noon eh. Hindi na makakakalat yun the rest of the world. Ang problema nung nagkakalat na rest of the world, tapos wala kang vaccine available. Kasi at that time, nung nagkakaroon ng SARS, 20 years ago, nagde-develop na ng vaccine. Kaya nadalian tayo ngayon mag-vaccine. Kasi yung dine-develop na ng vaccine at that time, mRNA, kaso biglang nawala si SARS for some reason. Tapos lumabas siya sa MERS-CoV, nawala din siya. So hindi nagawa kaagad yung vaccine. Kaya nung nagkaroon ng COVID, nagawa kaagad in 10 months time kasi yung template for that, meron na yung mRNA vaccine. Kaya natapos kaagad. Ngayon, ang question, bakit mas matapang itong bago? Because napabayaan natin siya for a time eh. Tapos walang vaccination for that. Dapat nun nakadevelop na dati ng bakuna for the SARS and MERS-CoV. So ngayon, ang problema natin, bakit marami na tayong bakuna and yet dumadami pa rin ang variant? Because of the vaccine inequity. Sa South Africa kasi, mahirap na bansa, kokonti ang kanilang bakuna. At saka mga Brazil, malalaking country, India, malalakas ang population, doon natutubuan. Kung napansin niyo yung mga variant, tumutubo po siya doon sa mga countries na malaki yung population po at mababa yung vaccination. Like ang Delta, galing yan sa India, na malaki ang population, mababa ang vaccination, nagiging more virulent. Ngayon, ang mangyayari, kakalat siya in bigger countries like Europe, malalaki. So, ang problema mo naman dyan is the mobility naman ng mga countries na yan. Kaya kumakalat siya. So, ganun ang history niyan eh. Kahit taas ang vaccination, tamo sa US ang taas. But ang mobility kasi nila increase eh. Tapos ang marami rin naman anti-vaxxer sa US. Sa US, ang one dose nila is 73%. Ang 2 doses nila sa population, 63%. Ang booster nila ay 30%. Pero ngayon, bumababa na yung cases nila because marami na sila kagad pinapabooster. So yun, ganun po yung yung history po, no? Sorry po, medyo mahaba yung explanation ko kasi nagtataka nga tayo bakit kung kailan patapos na, saka na naman tayo nagkaganito. It's because of the inequity of vaccines in countries na pinagmumulan. Kaya ang ginagawa dapat, pagka nakita mo kagad, yung travel ban mo kagad yung mga countries na yun na hindi makakapunta sa ating bansa. And then close muna ang borders natin dahil yung ating healthcare system mas mahina compared with other countries.
Thank you, Doc. So, if a person tested positive for COVID, how long before he can get a booster shot po?
Okay. Papagaling mo na siya ako, in experience ko, papagaling mo na siya ng 7 days. Then mag-extend ako ng another 1 week. Pwede na siya in 2 weeks time magpa-booster. Ang advice ko is 14 days after na gumaling siya. So I'd like to repeat that. Kunyari, positive ka, bibigyan kang gamot 7 days, mawawala yung symptoms mo, recovery phase kang 1 week pa. Kasi mahirap kasi kung magpabakuna ka and you're weak, baka yung mild adverse event ng bakuna, maramdaman mo ulit, hihina ka. At saka ayaw mo mag-introduce kung meron ka pang konting viral load, di ba? Kaya yung iba, patapos sila gumaling, nag-rapid antigen, alam nila negative na sila, saka sila nagpapa-booster. Pero kung magaling na naman, at maganda yung pakiramdam mo, alam na naman natin negative yun. Kaya in the States nga, di ba, ang isolation period nila 10 days to 5 days wala nang benefit ng testing kasi because of alam nila na 5 days lang usually ang Omicron sa kanila, which ang contention naman ng mga academic experts sa US dapat tinetesting pa rin kasi sinorten mo nga yung guidelines hindi dati 10 days at 10 days alam mo walang-wala na yun but kailangan ng economy and then ng healthcare workers kumukonti kaya yung isolation guidelines bumaba. Ganun yun yung dynamics. Ako naman personally as a physician, I will not compromise yung safety ng patient. Hindi ko ibababa pa rin. Status ko pa rin. Sana yun nangyari. But nangyayari kasi nagbe-bend yung guidelines natin based on the availability of the healthcare workers, based on the test kits na meron tayo. Kaya nag-a-adjust yung guidelines. Dapat hindi Dapat kung kailan ka merong sakuna ng ganito or calamity, all the more na dapat i-ramp up natin yung support for the healthcare workers. And then dapat yung test kits taasan natin kasi we're in a crisis. So ako, ang sagot ko dyan, I would like to err on the side of caution. Kagaling mo, 2 weeks tayo para sa ganun. Mas malakas ang katawan natin.
So given your household has been confirmed positive, is it okay to stay together and not isolate from each other?
Ideally, sana isolate, no? By solo ka lang. Pero kung wala talagang magagawa at maliit ang house nyo, then you just wear mask, no? Naintindihan ko yung concern na yun kasi ngayon, masyadong puno ang mga government facilities. Ang ideally, sana solo. Kung hindi, then you should wear mask pa rin. Actually, indoors, pagka meron ng isa, dapat lahat nakamask. Kahit naka-isolate siya. Kasi it might be circulating. Okay? Kunyari, 5 kayo, isa lang ang meron. Positive. Lahat ng 5 yan, nakamask kayong lahat. Kunyari, isolated siya. Ngayon, kung yung house nyo, hindi na masyado malaki, wala tayong magagawa doon, lahat nakamask habang ginagamot kayo. And hopefully, everybody will actually be treated.
Alright, Doc. So, what causes samples for testing to be rerun by the laboratory?
What
causes samples for testing to be rerun by a laboratory?
Kunyari symptomatic at negative yung rapid antigen mo. So, magre-rerun ka. Pero for practical purposes nga, sabi ko nga sa inyo, pag symptomatic ka, pwede ka na hindi magre-run, i-treat mo na lang siya. Pero kunyari, requirement ng workplace nyo na kailangan magre-run ka, then you follow the guidelines.
Okay. If you have used a self-testing kit and tested positive, what is the procedure should we do to report our results?
Can you repeat that?
If you have used a self-test kit and tested positive, what is the procedure should we do to report our result?
Well, kasi ang problema sa Department of Health, hindi pa nila kino-consider yung kung ano yung kanilang official, di ba? When everybody's using it, di ba? So, I think common knowledge na naman ngayon sa workplace na pag nag-positive ka, di i-report mo yung meron ka kaysa wala kang pagre-reportan. May symptoms ka and then you have naman an administered kit na ginagamit in other countries na reputable, then you can report that rather than wala. Kasi we cannot naman, I would say, stretch our employees kung talagang walang for RT-PCR kasi mahal-mahal ng RT-PCR tapos magme-medicines pa. Kasi ang difference na ngayon ng case natin, household members So how much one RT-PCR? Let's say 5 kayo. Let's say 4,000 pesos. Di 20,000 kagad yun. Wala ka pang medication. Mantalang ang isang rapid antigen, ang isang test kit, 100 pesos nga lang You can buy one ganito. Tapos ang dami nun. Ang dami mong matutulungan. Kaya dapat yun ang minamadali. And then i-regulate nila yung pricing. Kasi that's an enormous amount of money kung gagamitin mo yung RT-PCR. Samantalang the rapid antigen test can actually help a lot of people. So ako, for practical purposes, like dito left and right kami gumagamit kasi ilan ang doctor in the family, 5 kami rito. We know how to use it. And nakita naman namin ang benefit over RT-PCR. And then kami rin, kahit doctor kami, talaga mahal ang RT-PCR. Unless otherwise, yun ang requirement to say. For travel, the RT-PCR talaga ang requirement. Pero kung on a daily basis, ang tingin mo doktor mga anak mo, nag-duty, tapos pupunta sa house, has to be safe, then rapid antigen test ang ginagamit namin. For official purposes, like clearance for offices, siyempre, ang gusto nyo RT-PCR kasi you don't want an employee entering the workplace tapos nag-positive siya. And then, of course, sa travel, kailangan official RT-PCR. I think yun ang mga absolute requirement kasi hindi ka makaka-travel, hindi ka makakapalag sa work. Di ba may guidelines na every 2 weeks magre-report ka sa office, no? Pero I think they're considering rapid antigen test na rin every 2 weeks for the unvaccinated individuals. So those are the things na sinasabi ko kung ano i-report. It depends kung anong gusto ng workplace, ng human resources, no? But I think basically ganun ang understanding ko when I'm advising my patients.
I see, Doc. So ito, Doc, medyo economic yung question. Does the country still have the money for economic recovery? How did we spend all the COVID loans?
I think may money tayo. Kaya lang kasi, ang nangyari kasi niyan, nagkaroon tayo ng bago ang typhoon kasi natin Naintindihan niyo po ba? Nagkaroon tayo ng typhoon Kaya nagamit yung mga pondo nun. Tsaka bago pa lang ang budget natin. Remember, ang budget ginagawa October to December. January ngayon, fresh ang budget natin. So I think we have money kasi beginning of the year lang And sa company, alam niyo naman, ang budget ginagawa, di ba, December. So I think we have money. Ang kailangan lang is i-focus lang natin where the money will be used. And basically, dapat ako personally, on testings dapat natin siya kino-concentrate at saka sa home care remedies, yung kit. Kasi ang problema natin, ayaw natin hospital. Pero ang mahirap, wala naman pang home care kits Kaya yun ang tama si Congressman Kimbo Dapat dun nakakoncentrate. And then sa test kits, dapat din magbuhos ng pera ang tao. Lalo na sa nasa mga barangay area. I think we have money kung test kits na pag-uusapan. At nakita rin naman yung galaw in Israel and US. Ang focus sila is on test kits and boosters, no? Test kits talaga kasi pag wrong diagnosis, wrong treatment. And even sa company, I think you should invest on tests kasi very important yan. Lalo na sa workplace Kasi kung wrong diagnosis, wrong treatment. Kung walang test, wala rin treatment. Ang hirap nun. Kaya yung sinasabi na since meron na lahat naman ng Omicron, we assume mahirap po yun. Kung wala po tayong testing, how can we isolate and how can we trace? Diba? It's difficult. I hope naintindihan nyo ibig ko sabihin kung i-consider natin lahat. And kung sino ang mag-e-erran, siyempre yung negative. Sino ang mag-grocery and all. We cannot naman say na, okay, lahat na kayo positive na. Mahirap yun. Kasi pwede makahawa kayo sa inyong mga magulang. Kaya testing is essential kahit sabihin natin na i-consider natin lahat. Yan ang question kanina this morning sa talk show na doktor, sabi ng Department of Health po, i-consider na natin lahat. Kaya kasi yung test kasi kulang. Sa akin, at this point na habang may crisis, wag natin gawin yun. We should look for the money for this one. Ako, I encourage everyone na mag-test pa rin po kayo and not consider everyone na meron. Very important po yun.
Thank you, Doc. And I do apologize for everyone as we cannot accommodate all the queries. We already passed our time. So this will be our final question to you, Doc. Do you agree that Omicron is the beginning of the end of COVID?
I don't think so. Pag sinabi natin yan, we're trying to be complacent. Kaya nga, yung sinabing mild at saka blessing siya, medyo yung messaging, baka nakasama pa nga sa atin dyan kasi baka naglabasan pa nga mga tao dyan kaya lalong nag-transmission. We cannot say na this will be the end kasi 1918 pandemic, nagkaroon tayo, tapos nag-SARS, MERS-CoV tayo, nag-Wuhan tayo. No? I think this will be the problem in the future as we advance in technology and napapabayaan natin yung health natin. Nagiging cavalier and pinapaalala lang sa atin na we should be adhering to the hygienic measures, lifestyle pa rin. I don't think this will be the end based on my understanding ng population natin. Continuously, we will have this problem siguro for the next 3 or 4 years hanggat hindi tayo nakakapagbakuna kaagad. So yun ho, I don't want you to be complacent. Akala natin tapos na yung Delta and then suddenly meron tayo Omicron. Tingnan nyo po, meron na naman lumabas na variant yung Florona na it's a combination of flu and Omicron. Lumabas siya sa Israel and then there's a combination of Delta and Omicron. Ang pangalan Delmicron. So, imagine niyo yun, lumalabas yun. E paano kung magkaroon ng combination ng Omicron at saka Delta? Isang ferocious na virulent at highly transmissible. That is a super mutant variant. Sana wag mangyari. Kaya dapat talaga magpabakuna so that we can actually prevent Delta kung na-eradicate na natin. So, ang concern na lang natin is the Omicron.
All right, thank you very much, Doc. Again, we apologize that we cannot accommodate all your queries, but you can watch this session again sa ating YouTube channel and our website on the coming days. So we truly appreciate you, Dr. Lechon, for taking some time and sharing your knowledge on the latest updates on COVID-19. Even though the pandemic started almost 2 years ago, the end is no way near, as you have said nga po. So let us continue to keep ourselves and everyone safe against COVID-19, and we encourage everyone to always wear your mask properly, maintain social distance, go out for essentials only, and be vaccinated. So on behalf of Generali Life Assurance Philippines, thank you for joining this webinar. We look forward to seeing you again for our next webinars. And once again, I am Hennet Piloton of Generali Philippines. Thank you and enjoy the rest of the day.
We at Generali want to enable people to shape a safer future. To do this, we will be now more than ever lifetime partner to our customers. Building on our strengths and looking to the future, we will champion sustainability to become the originator of our strategy with a greater contribution to the green and just transition. As the leading insurer and integrated asset manager in Europe with undisputed financial solidity and as a recognized data-driven innovator, our mission has already begun. For our customers, we are trusted advisors, offering personalized solutions that fit what people really need. We know how to do it. Because before being a community, before being clients, and even before being a partner, before anything else, we are people. And as people, as Generali, now more than ever, we want a safer world.